Hello everyone, it's Dr. Craig Bentham from Backfit.ca. We're back here with Dr. Stephen Faulkner, medical doctor for 30 years. Honored to have you here so that we can get his perspective on chiropractic. So one of the things, Dr. Faulkner, that I want to ask you is a lot of our patients come in because they're in some sort of pain. They have a symptom, they have either lower back pain or neck pain or headaches or sciatica. And my question to you is that the best indicator of spinal health?
If it's an acute injury, then sure, we've got to explain why that pain is. Mm-hmm. But what I've seen a lot in medical practice is chronic pain. It creeps up on people slowly and imperceptibly, and they don't realize that they've been letting their back slowly deteriorate, and they could have got it early. It's a bit like going to the dentist and having preventative dental care. When you get to pain, you've left it late. And a little physiology, anatomy of the spine can help explain this. If you look at this picture here, this is a cross-section of a nerve root. And the nerve root is the nerve that comes out between each vertebrae, called the intervertebral space. And each of these nerve roots comes out, and there's pairs, they come out at every level. So what happens with the compression of the intervertebral disc is that the nerve gets compressed. And the nerve is made up of three parts: the autonomic part, the sensory part, and the motor part. And when you get to when you get to pain, then doctors start to pay attention. But when you get to loss of power, which is the end stage of this nerve root compression, then things are in poor shape. And if we can get to relieving the pressure on the nerve roots way before that, then we're going to save a lot of autonomic problems, which can show up in loss of energy, low blood pressure, digestive problems, even allergies can be related to autonomic problems related to nerve compression.
Okay. So how would patients know? Thank you. How would patients know if they had an autonomic nerve problem?
Well, if they go to their doctor, the doctor will only be listening for sensory problems, like I've got pain here, or motor problems where I can't move my wrist or I can't move my knee because of the nerve has been damaged. So they may not know that it's, and we're not taught at medical school that autonomic problems can be related to spinal care.
So that's why we say, I wish, I say this anecdotally, I wish all of us had a red dot on the top of our heads saying we have nerve compression, because as you and I both know, most of the nerve system doesn't have pain sensory in it. And so a lot of the times we have nerve compression either through the motor nerve root or the autonomic nerve root, and we don't know. And so the best way is to get a proper assessment and to evaluate that properly through a doctor who specializes in that. Mm-hmm. So any more thoughts to add, or are we?
Well, I think once a person has chiropractic and has experienced traction, experienced some exercises to improve mobility and posture, then they will feel better. Mm-hmm. And that's huge. Mm-hmm. You will feel improved health and energy.
Fantastic. Well, thanks again for joining in, folks. Stay tuned for more questions to Dr. Faulkner. Thank you again for being here.
Pleasure.